Good morning. Welcome to, I guess it's noon now. Good almost afternoon here. Welcome to our kickoff for the Crisis Response Improvement Strategy subcommittees. We really appreciate all of you volunteering to do this work with us and being on the call today. I want to let everyone know we have both subcommittee members and members of the public joining us today. And I'm seeing 154 people participating, so this is very exciting. We decided to do an all subcommittee kickoff just to do some level setting and make sure everyone's on the same page. And then you'll be in the future meeting in subcommittees. So my name is Jamie Strauss-Clark. I am the facilitator for the Crisis Response Improvement Strategy Committee, and I am facilitating today's conversation, although most of it is going to be in breakouts with you getting a chance to get to know each other. So with that, I want to start, as I most often do, with a quick tech review to remind everybody of how the Zoom works and sort of meeting expectations. And Liz is going to help by advancing the arrows to point out where we need to be. Unlike some of our other meetings, because we have so many people on today, we're inviting you, at least during this portion of the meeting before you move into breakouts, to decide if you want to have your camera on or off. That is up to you today until we move into breakouts, and then we'll have some different instructions for you. But everyone should have their mics on mute unless they're speaking. And that, just as you know, probably from the thousands of Zoom meetings you've done over the last 22 months or so, just helps weed out any background noise and distractions. So Liz popped up the arrow there. That's where your mute and unmute button is on your screen. And please keep that on mute unless you are speaking. And then Liz, if you can click ahead, your video controls are there. You can turn on your video if you want to be on camera, or turn it off if you prefer not to. At least at this point, we'll have different instructions for you, as I said, when you go to breakouts. Click ahead again, please. All right, we do use our raise the hand function to ask questions. Again, this really helps avoid talking over each other. And to find that, you click on that reactions button on your toolbar, and it pops up a little window that you can see there, and you click on raise your hand. And then I will be calling on you in the order that I see your hand raised. I'll walk through our agenda shortly. We're not going to be doing any kind of Q&A or discussion in this room. Most of the discussion is going to be happening in the breakout, so you can try out that raise your hand function then. Click ahead, Liz. Chat. So the chat today is if you have questions and I'll repeat this later again, if you have questions that come up during the level setting presentations in the first half of the meeting, please pop those in the chat to Nicola. Nicola is going to be compiling all of the questions, and then we're going to be putting together FAQs along with some of your questions from some of the previous meetings and posting them to the website. So rather than doing Q&A verbally today, which can take up the time, but we really want to have you talking to each other in breakouts, we're going to compile all of your questions, come up with the answers, and then put them in an FAQ so everyone can have access to them. So again, in the chat, you want to send any questions that you think of during the presentations to Nicola Pinson, and she'll be pulling all of those together. If you have any technical issues today, please send a chat to HMA events. So those are your two chat people you can reach out to during the meeting. Click ahead again, Liz, please. All right, I always recommend this. If you want to be able to see as many members as possible, click on that speaker view and set it for gallery. You will be looking at presentations for a lot of meetings, so those images are going to be on the right-hand side of your screen, or there's some different ways you can arrange it. But for at least for a part of this session where we're sitting together in the main room, a lot of it's going to be presentation. Click ahead again, Liz, please. All right, so this is going to be a kind of a new thing for some of you. We are going to be moving into breakout rooms today based on subcommittee assignments. And members of the public, we're going to invite you to choose which subcommittee you want to sit in on and observe today. And so to do that, when the time comes, you're going to click on, so subcommittee members, you're going to be automatically assigned, and I'll review this again when the time comes. You're going to be automatically assigned to your rooms based on your subcommittee membership. Members of the public, when you want to choose a room to go to, you're going to click on this breakout rooms button. It's going to pop up a window. Click ahead, Liz, please. And it's going to say join a breakout room. Then you click on that button. It's going to pop up one more window. Click ahead. And that's going to tell you, these are actually going to be named based on subcommittee, so you can choose your room there. If all else fails, we have folks hanging out in the main room who can help you get to the room you want to go to. So don't panic if you've never done this before. We will make sure you get to the room you want to go to. And I'll repeat these instructions when we get to the breakout rooms. All right, so that's it for our tech moment. I want to pause for just a moment and ask one of our Chris committee co-chairs, to offer some words of welcome before we go through our agenda. So Representative Orwell, would you like to welcome our subcommittee members today?
Absolutely. I am so excited to be here today, and I want to thank you. Thank you for signing up to be part of the subcommittees. For me, this is where we roll up our sleeves and really start getting things done. You have the expertise we need to understand, how does the system work now? What's broken? How do we fix it? How do we embrace best practices? So this is our opportunity to think big and really come up with some great recommendations that can go back not only to the CRIS committee, but to the legislature. So again, I know your time's precious, and thank you for really dedicating your time and energy to this work. And I really am excited about the work that's going to come out of the subcommittees. Thank you.
Thank you, Representative Orwell. I also want to take a moment to pause. At our CRIS committee meetings and steering committees, we have different co-chairs offering a land acknowledgement at this point. And for those of you who have done land acknowledgements or participated in that, you know that it is not something you do at the last minute or without research and thinking. It is really something that takes some thought and pulling it together. Unfortunately, today, the person we had hoped would be able to do the land acknowledgement is not available. So we are not offering a land acknowledgement today, although certainly it's on my mind as I'm thinking about this. But we do intend to continue to offer thoughtful, meaningful, well-researched, well-considered land acknowledgements at CRIS and steering committee meetings, and also will be providing guidance to our subcommittees for how to do this in a thoughtful and meaningful way. So please keep our Indigenous and ancestral lands on your mind in this meeting, and we will be providing guidance on land acknowledgement in the future. And I also just want to mention that subcommittee meetings will be primarily working meetings. We're doing a lot more of the formal pieces in today's meeting because it is all of you, and we have so we'll be providing more guidance soon on how those subcommittees meetings can roll. I want to just take a moment to introduce the staff who you'll be hearing from today, and also who will be supporting the breakout rooms. And so staff, when I call your name, if you could just turn on your camera if it's not on already, and introduce yourself to our subcommittee members and our members of the public, and then we'll get started walking through our agenda. So first, we have Beth Mizushima from Department of Health. Beth may not be on yet, so we'll circle back to Beth. How about Charissa Fontanos?
Hello, I'm Charissa Fontanos. I'm the Deputy Chief, that's okay, the Deputy Chief Medical Officer and Acting Medicaid Director at the Healthcare Authority. Nice to be here.
Charissa, my apologies for mispronouncing both of your names. That was impressive.
Not a problem.
All right, wonderful. And then I'd like to introduce Betsy Jones.
Hi, good afternoon, everyone. I'm Betsy Jones with Health Management Associates. I'm leading the work that you'll hear about shortly. It's nice to be here this afternoon.
And how about Nicola?
Hi, everyone. I'm Nicola Pinson. I'm with Health Management Associates and a lead project manager for this work. So glad to be here and to have all of you here.
And I'm going to circle back to Beth. It sounds like Beth was having tech issues, but is back with us. So Beth?
Yes, hi everyone. Good afternoon. So happy to be here. My name is Beth Mizushima. I use she, her pronouns, and I serve as the Director for the Office of Healthy and Safe Communities at Department of Health. Thanks so much.
And Beth and Charissa will be our presenters today. Mark Snowden, are you with us? Nope. Okay. How about Suzanne?
Good Good afternoon, Suzanne Rabideau with Health Management Associates. It's such a pleasure to be with so many of you. Thank you for participating and volunteering to make a difference for so many in the state of Washington.
Thanks, Suzanne. And how about Jim Volendroff?
Sorry, it took me a little while to get off mute. Good afternoon, Jim Volendroff. I'm the Senior Advisor for Policy and Advocacy for the Department of Psychiatry at UW Medicine. Glad to be here today.
Thanks, Jim. And then Michael Anderson-Nathy.
Yeah, hello, everyone. My name is Michael Anderson-Nathy. I use he, him, his pronouns. I'm an independent consultant partnering with HMA on this project, and happy to be here and to help out in any way I can. Thank you for your work today.
And finally, Liz Arjun.
Hi, everyone. It took me just a second to unmute and show my screen as well. My name is Liz Arjun. I'm the consultant here in the Seattle office. Excited to be a part of this work with my fellow Washingtonians.
Thanks, Liz. All right, Liz, if you could put the agenda back up on the screen, I'm just going to walk folks through how today's going to go, and then we'll start diving into the presentations. All right, so just a quick overview of our objectives today. Of course, the first and foremost, we are laying the foundation for building and sustaining collaborative working relationships with each other and launching each of the CRIS subcommittees. A big portion of what we're covering in the first part of the meeting today is helping all of our subcommittee members get grounded in the behavioral health system redesign process, including our organizational structure, process, and high-level deliverables and timeline, as well as meeting schedule. And CRIS committee members, I know that you've gotten some of this information already. There are some new pieces of information since this was last presented to you, so hopefully it won't feel like a complete repeat for you. We're going to provide you with an update on the comprehensive assessment that's in progress right now, as well as other House Bill 1477 implementation activities, including the 988 National Suicide Prevention Lifeline launch. And then we will conclude with a public comment period. I want to let folks know we have 25 people signed up for public comment today. So I am going to use my facilitator's power to have comment time periods 90 seconds each. And that way we're hoping to get as many of the people who want to speak today in as possible. A quick reminder that making a public comment in a meeting is one of two key ways to be heard in this process, to submit your comment. There is also an email on the HCA HB 1477 website, which we'll post in the chat. You can always send a comment there, and we make sure that we compile and share those with all of our CRIS committee and soon to be subcommittee members. So please know that those comments are heard, and we don't weight verbal comments in meetings any more than written ones. So if you don't get called today and you wanted to make a comment, or you prefer not to speak in public or whatever reason, please feel free to use that email address to submit your comment, and we'll make sure folks see it. So quickly, we're almost done with our welcome introductions and reviewing our meeting agenda. And then we're going to move into providing an overview of the behavioral health system redesign process. Then we'll offer some updates on HB 1477 implementation. And at 1 o'clock, we will move into breakouts where you're going to be spending some time introducing yourselves to each other. This is just the first getting to know you opportunity before you all move into your regular subcommittee meetings. We'll do some wrap up and next steps at 1:35, and then move promptly into our public comment period at 1:38, when I'll remind you of instructions for how that's going to work and get going, and adjourn at noon. So I think that is it for our opening remarks. So let's actually turn it over to Betsy, who's going to provide you with an overview of the behavioral health system redesign process.
Thanks, Jamie. Betsy Jones, back again. I am as I mentioned, Health Management Associates managing principal of the Seattle office, and I'm leading the work on behalf of HMA. And we have been subcontracted through the Behavioral Health Institute at Harborview, which was named in the 1477 legislation as the lead for providing meeting facilitation and staff support for the CRIS committee meetings. and the House Bill 1477 deliverables outlined for the committees. And I'm going to apologize that I'm pretty sniffly. I've been struggling with a bad cold. So just so you all know, I'm not 100%, might be sipping some tea while I talk to you. So just a little bit for an overview, House Bill 1477 established a structure, a committee structure. It established the CRIS, which is the Crisis Response Improvement Strategy Committee, a steering committee, and subcommittees, which is the focus of our time with you all today, to make recommendations necessary to implement and monitor the progress of the 988 crisis hotline in Washington and for the statewide improvement of behavioral health crisis response and suicide prevention services. So whereas nationally, all states will be implementing 988, the 988 line this coming July, Washington State took the lead and went further and determined that we would look at the crisis response system overall and make recommendations for the downstream services. So when someone calls the 988 line, we want to be sure that we have a place to catch folks. And so we will be looking comprehensively at not only at the 988 launch and then what will become crisis hubs, but also at our crisis response system, our behavioral health system overall. So some key milestones that we are paying attention to. January 1st of 2022, right around the corner, we will be delivering a first progress report to the governor and the legislature, which includes the results of a comprehensive assessment that we've been working on. HMA has been very focused on this comprehensive assessment this fall. As well as preliminary 988 funding recommendations. And I will show you a slide, we'll move to a slide in a moment that will kind of lay out the timeline in more detail. In January of 2023, we will deliver a second progress report to the governor and the legislature, which will include recommendations related to crisis call center hubs. So beyond the crisis call centers that will launch, the 988 line that will launch in July, to the call center hubs, and then final 988 funding recommendations. So this, you might notice that in that, January 22 to January 2023 timeframe, that's kind of where your work begins and what we're all focused on here today. So thinking about the launch of the line, the development of the hubs, and then the recommendations for crisis system services. And then in January of 24, we will deliver a final report to the governor and the legislature, which will include recommendations in more than 13 areas outlined by the legislation. Next slide, please. So the committee structure looks like this. We have a steering committee, which is comprised of 6 members that are also members of the CRIS committee. We have a representative from the Healthcare Authority, Carrie Waterland, a representative from the Department of Health, Michelle Roberts. The Office of the Governor representative is Amber Leaders. Sorry, this is my cold speaking to you. We have a Senate member, Senator Dhingra, and a House member, Representative Orwell. And then we added a member of the CRIS committee representing lived experience, Bipasha Mukherjee. So that's the composition of the steering committee. And then for the CRIS committee, which is our big body, the CRIS committee making recommendations up to the steering committee, we have 10 designated seats and 26 seats that were appointed or requested by HCA. So the Healthcare Authority did the work of identifying additional members for the CRIS, representing certain stakeholder seats. And so we have a total of 36 members on the CRIS. And then we have 7 subcommittees, 5 which were named in legislation, the first 5 that you see there. The Washington Tribal 988, which is actually being driven through the Tribal-Centric Behavioral Health Advisory Board. So they are not represented in the standard format. We're working through and with the tribes to do the work of the Washington Tribal 988 subcommittee. Then we have credentialing and training, technology, cross-system crisis response, confidential information compliance and coordination. That's a mouthful. And then we added 2 subcommittees that were not named in legislation, the lived experience subcommittee and the rural and agricultural subcommittee. Next slide, please. So this is just a depiction of the structure that I spoke to a moment ago. And really to focus you all here today on the subcommittee role, which is what you're most interested in. The subcommittees will provide professional expertise and community perspectives on discrete topics. And we will be thinking more about that. I'll speak to that in a later slide about the work that we'll kick off in January to begin the process of deliberation for these subcommittees. The subcommittees will, again, make make recommendations related to those subject areas that will roll up to the CRIS and then up to the steering committee for final recommendation and inclusion in reports that I spoke to you about. Next slide, please. So this is the busy slide. I wanted to talk to you about some key milestones and timelines for our work from this year through the end of 2023. You'll see in the green boxes, I'm going to spend most of the time below the line speaking to you about some key deliverables that we have. The green boxes are the reports and the deliverables that are named in the legislation that the steering committee will ultimately be responsible for. So in the January 1, 2022, as I mentioned, the comprehensive assessment, which includes the current state assessment, as well as preliminary budget recommendations related not only to the 988 line, but also crisis services across the state. And HMA, Health Management Associates, has been spending a lot of time doing stakeholdering, having interviews, trying to understand the crisis system in Washington state to put into this current state assessment. And it will form the basis of the work that we begin to do together as subcommittee members. The current state assessment, the comprehensive assessment, will inform the work that we do as subcommittees about where we are today. And then, as Rep. Orwell mentioned in her opening remarks, our work together will be about taking that current state and really projecting forward and thinking about where we want to go. So what is the vision for the future state based on the framework and the backbone of this current state assessment? And what I want to say about the work that we've been doing here is that it will be, it's dynamic. It won't be a perfect document. We will grow it and modify it as we understand more things about our system. In the second green box, the January 1st, 2023, as I mentioned, we'll be making recommendations related to crisis call center hubs. So this will be beyond just the launch of the line that will happen in July, but we'll be contemplating in 2022, as subcommittees and then up to the CRIS and the steering committee, what the call center hubs will look like. And I'll speak in the blue boxes a little bit more to work that DOH and HCA are doing as well as implementers along the way. And then January 1st, 2024, that third green box, the final report with recommendations. And then I'll turn to the blue boxes now. And this is, these boxes are related to work that the agency and the department are doing. So Department of Health and Healthcare Authority are really in charge of implementing, and they are wanting recommendations and wanting support from you all as subcommittee members to help inform their deliverables. So July 2022, the new 988 National Suicide Prevention Lifeline will launch. You'll be hearing a little bit more from Beth Mizushima I'm sorry, Beth, I didn't say your name right. You'll hear a little bit more from Beth shortly about the launch of the 988 line. And then in January of 2023, there will be agreements with the managed care organizations and the BHASOs, and that will come from the Healthcare Authority to support services and coordination around the crisis services that we need in our community. So new resources coming online, and you'll hear a little bit more about these from Dr. Fotinos in a little bit. And then July of 2023, really looking at what crisis call center hub standards and best practice guidelines for those call center hubs will look like. And that will be informed by the recommendations that we make in January of 23 related to those crisis call center hubs. So all of your work in 22 will push forward and inform the development of the standards. You know, we've got the training and credentialing committee, subcommittee, and the best practice guidelines for those call center hubs. And then in 23, the technology platform, our technology subcommittee, will make recommendations to support the technology platform being fully funded. And then finally, in July of 24, the call centers will be designated as crisis call center hubs by the Department of Health. So you see that we have a number of years ahead of us to really work towards that ultimate vision of launching these crisis call center hubs and having services in the community that link and support the work that we're all envisioning. I probably spent too much time on that slide, Nicola. I apologize. We can go to the next. So next steps for you all in our subcommittees. HMA, the subcommittee facilitation team will be following up with you with a committee calendar. We'll be developing agendas to inform the CRIS and steering committee recommendations. We'll be developing charters for the work so that we can focus on what our objectives are and where we're going together. And as I mentioned, the comprehensive assessment will inform the subcommittee priorities going forward. So that will be an exciting document for us to have in hand. And that will be delivered to the governor and the legislature on January 1st. So we'll be armed with the comprehensive assessment to begin our work together. And then finally, all committee and subcommittee meetings are open to the public, and public comments and questions are welcome at any time. And you'll see the ways to provide public comment via email. And also you see some resources there that are available on the CRIS webpage. And I will hand it over, I believe, to Beth to talk about implementation efforts.
Great, thank you so much. For anyone who just joined, I'm happy to do a quick introduction again. My name is Beth Mizushima, and I serve as the Director of the Office of Healthy and Safe Communities. And I'd really like to just first start off by expressing my gratitude. We're really grateful for the opportunity to be able to come here and present to you all. And a big thank you to our partners at Healthcare Authority, the Governor's Office, all of the CRIS committee members, as well as the steering committee members, community members who are here today, thank you. And of course, Representative Orwell and Senator Dingra also for your leadership on HMA and everyone's partnership on this really important work. Next slide, please. So today I'd like to share some of the key highlights about the work related to 988 implementation that we have been working on here at the Department of Health. We manage the contracts for the National Suicide Prevention Lifeline member centers in Washington State. Currently, we have 3 member centers. The third center, Frontier Behavioral Health, became accredited and started taking National Suicide Prevention Lifeline calls this past July. And we also received a 988 state planning grant, which is funded by Vibrant Emotional Health. They are the national administrator for the National Suicide Prevention Lifeline. And these private funds were made available specifically to prepare states and National Suicide Prevention Lifeline member centers to collaboratively prepare for 988. We began this work with our grant partners listed here on this slide in February of this last year, and we are currently in the process of wrapping up our grant deliverables. Next slide, please. So today I'd like to share a few key highlights of this work. One of our grant deliverables included convening a coalition of stakeholders to advise on 988 planning. And we are so grateful to all the individuals who participated in that coalition. Listed here on my slide is just a summary of the participants, but the group was very diverse and brought a wide variety of expertise. And some of you here today may have participated in that process. So many thanks to you for your role in that, as well as transitioning to this one. And for those who have not transitioned into the formal CRIS structure here, we do really look forward to hearing more in other meaningful ways, like attending public meetings like this one that are open to the public and include public commentary, the other community forums, and other methods that the CRIS committee may roll out in the future. So I just wanted to highlight one of the key takeaways from that work was really the importance of having people with lived experience contribute their input. You know, when people who utilize crisis services are a part of informing the work of the member centers, we believe we can better ensure that those services are representative and responsive to individuals' needs. And this value and perspective is widely shared, and we are very excited to see you all here who are serving on the Lived Experience Subcommittee. Next slide, please. So the grant planning team also assessed members' centers' needs to help plan for 988 implementation. All 3 member centers can operationally take the 988 calls starting in July, this next summer, and callers can be connected with the Veteran Crisis Line as well as receive services in Spanish as needed. In partnership with the American Indian Commission, Washington has launched the Indian Behavioral Health Hub within the Volunteers of America Member Center. And with the additional funding provided in House Bill 1477, partners were able to enhance implementation and establish this dedicated call line for tribal individuals sooner than later. And one of our Washington Member Centers, Volunteers of America, has also been participating in a national pilot program to plan for text capabilities. This pilot has really helped a lot with learning what the capacity is needed to conduct texting, as well as insights into the technology that will need to interact with texting apps. Recently, the Federal Communications Commission, or the FCC, announced that texting 988 will also need to go live in July. And at this point, we're communicating with Vibrant, that national administrator of the National Suicide Prevention Lifeline, to understand what decisions they will be making for addressing texting capabilities as they oversee the accrediting process for member centers to conduct texting. So we will continue to closely monitor the decisions at the national level and continue with planning on our end so that we can best align our state's efforts. We have also been conducting planning for the 3 member centers to be able to expand and sustain their centers' capacity to maintain the required 90% in-state answer rate for current and projected 988 calls, chats, and texts as the implementation rolls forward. And really, truly, the key challenge will be ensuring that the capacity can scale at the same rate as 988 implementation and call volume. For the next few months to come, a key focus with our partner member centers will be on preparing for those calls and now texts to go live for 988, in July. Next slide, please. So the Vibrant grant has given us a better understanding of the operational realities and some of the key performance indicators that member centers must meet, and helped identify some planning considerations to ensure that call centers can meet the Lifeline standards for how services are conducted, all the minimum requirements expected by the National Suicide Prevention Lifeline, and performance metrics. And in partnership with our National Suicide Prevention Lifeline member centers, our immediate focus is planning for the July launch, but we have also been considering the planning needs around that full-scale 988 implementation that is on our near horizon. And to really implement what is outlined in 1477, there will be a lot of work and attention in the years to come around developing training for staff, both initial training as well as reoccurring training to help maintain the work, and also planning around how to ensure the 988 system connects with the 911 system. So as you can imagine, the technology piece will be a big part of that, but also in thinking about the training, also really helping teams from both 988 and 911 really have that learning and that connection. So next slide, please. So my last slide, I just wanted to share a visual of what we're working towards, that really comprehensive system of care, where once fully implemented, all crisis service partners will be working together so that when a person calls, texts, or chats 988, they will be connected to a behavioral health operator at an accredited National Suicide Prevention Lifeline member center. And that member center will triage the individual's situation, conduct safety planning, or connect directly to culturally, geographically, and linguistically centered resources. And when necessary, such as a medical emergency, calls will be transferred to 911 and vice versa. And additionally, of course, follow-up calls will be made to ensure callers can access and be supported by additional resources as needed. So I hope this overview from our team has been helpful so far. We are honored to be a part of this work and really appreciate your time today. And now I believe I will be turning it over to our partner, Dr. Fotinos.
Good afternoon. Thank you, Beth. Again, for anyone who's joined the call a little bit after it started, my name is Charissa Fotinos. I am the Acting Medicaid Director and the Deputy Chief Medical Officer at the Healthcare Authority. I'm going to take just a couple minutes and talk about some of the work that the Healthcare Authority has, both related to 1477, but also how that fits within the context of the larger set of work that HCA is doing as it relates to behavioral health. And I want to start by thanking both Representatives Orwell, Senator Dhingra, the legislature, and the governor's office for really recognizing the need to focus a lot of attention and resources on our behavioral health system. It is statewide, full of people who care and are passionate about their work, want to help people who are struggling, and yet we still have gaps and need to figure out how to better meet the needs of people who are in both crisis, but I would say near crisis. So first slide, please. For a second, I guess. So the Healthcare Authority's work is broad ranging. We support the behavioral health services across the care continuum, both for the Medicaid population, but as well as the public employee and retiree benefits programs. We do not manage or administer the management of the state hospitals, but we are very involved in supporting the care coordination and discharge planning for people leaving those settings, and as well as trying to identify people who would best be served by care in those settings. We contract with the managed care plans who provide the bulk of the behavioral health services or pay for the bulk of behavioral health services for people on Medicaid. There is a subset of people, whether they are people who are eligible both for Medicaid and Medicare and or tribal members who are not part of the managed care system or may choose not to be. Those are managed through a traditional fee-for-service payment system. For folks who are either not insured at all or the general population, the behavioral health administrative service organizations are also responsible for the support of the crisis system across the state. And the Healthcare Authority does contract with those agencies to help support the crisis system. We as well provide support, financial support to the crisis response lines. And the other piece that the Healthcare Authority does is administer the federally funded substance abuse and mental health block grants. So the Healthcare Authority has a broad involvement in both the medical and behavioral health systems, primarily as a payer, but in recognizing the fact that 1 in 3 people are in the state, for the most part, are either insured by Medicaid or through the state public employer retiree benefits plans, we do have the ability to support and provide assistance to work just like this. Next slide, please. I'm a primary care physician. I'm a family medicine and addiction medicine doc, and I was in practice for a number of years before I started to join county and then state government. And what we have right now are, for the most part, 3 separate systems of care. We have a system of care for medical health, we have a system of care for substance use related care needs, and we have one for mental health. We have a crisis response system as well that is variably resourced and staffed depending on where you are in the state. But we have these parallel systems of care, and there's not an entry point except for 911, which we're all aware of the different challenges that trying to refer any type of crisis into a single setting that then primarily relies on law enforcement has led to. We don't have a system of care that is communicating with each other, that has a central way in which to have people enter and track through the system, or have a way in which to find out what capacity exists in the current system of care, whether that be a hospital bed, a crisis center, a respite center, or even outpatient follow-up. So what we've got now is, I would say, a jumble of systems. Next slide. And what we're trying to create is really a person-centered system of care. We have systems, but they're not yet an integrated system. We want people to be able to, in their own life, identify a crisis. I think we think of crisis as a horrific event. The tragedy that occurred in Michigan, the flooding that leads to loss or livelihood. But a crisis might be, I just lost my job. How am I gonna pay my rent and feed my kids? I'm not yet at the point where I'm considering harming myself or others, but that's a crisis for me. How do we allow people who are at varying stages before they get to full-on crisis access and entry into a system that allows them to share their pain, share their concerns, and be directed appropriately to the place that best meets their needs at that moment in time? That's what we're trying to create. We have little systems that have tried to do this all over the state. So I guess one thing I want to say is this will require patience. We will not be able to do this with all of you who've dedicated your time to serving on the subcommittees and helping inform us how we help implement the law and the directives that the legislature and governor has given us. So we need your help, and we need to recognize we have a system that's been up and running for decades, and it's going to take a little bit of time to understand what the needs are and direct resources appropriately to do so. I think this is an exciting time, an opportune time, and it's a huge piece of work, and we all need to share the grace and committed passion that we all share for this work as we go forward. Next, please. What we're trying to create really is a system of systems. You heard a little bit from Beth about the work that the Department of Health is doing, really to stand up the call centers. They'll be responsible for the information technology piece that supports the 988 call line, integration with 911, integration with the existing crisis call centers, as well as really the training folks for the crisis management response. The healthcare authority's job is to kind of take all of that and assure that those pieces connect to the crisis care providers themselves, to an ability to look at what sort of beds or resources are open at any point in time in real time, the ability to create and track appointments, to follow up with folks, and to assure that provider communication is timely and relevant. So that's the middle piece of work that the healthcare authority is responsible for. And then the crisis service providers are the ones who will be contributing to the bed registry, having their electronic health records help inform what's available, what's not available, provide real-time access information and follow-up appointments. And I want to say that we, unfortunately, I think still stigmatize and discriminate against people with behavioral health conditions. So as is always important when we're talking about people struggling with either substance use disorders or mental health disorders, data privacy and security is important. We want people to have appropriate view into information that helps them do the job that they are in the role to do, but we also want people's privacy and security paid attention to. Next slide, please. So Going forward, the Healthcare Authority will continue to work on the integrated behavioral health client referral system, which will include the development of a real-time bed tracking and bed counting registry. We are responsible for helping to deploy and track local responses. We want to know how the system is working as we go forward. We want to track call outcomes. We want to know that if someone reached out in crisis, that they got somewhere, and whether or not they chose to take the referral that was given to them, that person gets a check back to say, hey, are you okay? I heard you were struggling yesterday, or whatever the case may be. We want to make sure that people get what they need, whether it be crisis system care or not, and that we're able to follow folks as they transition through different services. And we want to provide person-centered services. We know that the 988 line is meant to serve all crises. Certainly there are none more urgently lethal than someone who's considering harming themselves or others. And I would argue also that now that we're seeing a lot of opioid-related overdose deaths with fentanyl, that's also an urgent crisis. So how do we create something that can respond to that in real time, but also to that person earlier who may have just lost their job and is worried about paying their rent and providing food for their family. Key partners in this are our tribal governments. We want to assure that the access that they require for their members is as well there and matches appropriately and fits into this as they see fit. And most importantly, we want to continue collaboration across the continuum of care and the multiple behavioral health initiatives that are out there. This is not, as you're likely all aware, the only body of work that the legislature has asked us to be responsible. There is also the Blake work, which is the placement of recovery navigators in communities across the state to help people who may be struggling with substance use disorder be redirected from the law enforcement system to whatever sort of supports they may need. So we're really talking about something that needs to reach people who are living houseless in the woods under a bridge, people who have a home, people who are in a clinic, in an emergency department, wherever they may be. We need to provide a system that is responsive to that. So as we go forward, the Healthcare Authority will be tracking all of these things that we are helping to support and provide resources to assure that as you build out and give us recommendations to build a system, that we make sure it all connects with each other and that the information exchanged across it is seamless. And I believe that is the next slide. Oh, I did want to mention just two things. The mobile crisis response, there was a question that came up, I think, in a conversation recently about that. That will be for the mobile crisis response teams. That will be part of the subcommittee's group to make recommendations to the larger committee for how and where to implement those. That is separate from work that's come from the Children Youth Behavioral Health work group that is also looking to stand up mobile crisis systems for youth. That's concurrent and separate, so wanted to just clarify that for folks. Thank you.
Thank you, Beth and Dr. Fontinos. I appreciate it. Now we're going to be moving into the interactive portion of our meeting today, and I want to give you some instructions before we send you into those rooms. We're going to be sending, as I mentioned earlier, we're going to be sending subcommittee members automatically into breakout rooms based on your subcommittee assignment, with two exceptions. The cross systems and lived experience subcommittees are both large, and so we're actually breaking those into a few breakout rooms just so it can be a little more manageable. People can have more chance to interact with each other. I'm going to offer you some instructions for how we're going to do those rooms. But first, for our members of the public, our guests today who are not assigned to subcommittees, after we send our subcommittee members out to their breakout rooms, then you'll have an opportunity to choose a breakout room based on which subcommittee you are interested in observing today. So let me tell you a little bit, and we'll help you out with that if you have any trouble finding those rooms. Let me tell you a little bit about what's going to happen when we send you off to your rooms today. So the purpose, as I said earlier, of you spending time in these breakout rooms is to lay the foundation for your ongoing collaboration by starting to get to know each other. There's going to be at least one CRIS committee member in each breakout room, and we are also dividing up our staff to try to support as many rooms as possible, but there may be a few rooms that don't have any staff in there. The CRIS committee members are going to call on each subcommittee member based on the order they see them in their screen and invite them to offer a brief introduction. We're asking you to keep your introductions to about 2 minutes, and that will allow us to get through most or all of the subcommittee members in each room. And how you may choose to structure your introduction is to offer your name, your preferred pronouns if you like, and then I want you to answer 2 questions in your introduction if you can. First, what brings you to this crisis system work? And second, why are you interested in participating on this subcommittee? So I'm going to send that out in the chat to remind everyone, but your CRIS committee members also have this information and they will be able to help you forget. One more really important piece of information that our CRIS committee members and staff members may repeat when you get into the room. In order to facilitate introductions amongst subcommittee members, we're asking each subcommittee member to have your video camera on if you can. That will allow your CRIS committee member to know who's on the subcommittee. If you're a member of the public, if you are not assigned to a subcommittee and you're observing that room, please turn your camera off. It will make it a lot easier for our CRIS committee members to be able to know who to call on for introductions. And members of the public, today when you're sitting in the breakout rooms, please, you're just observing today, it's subcommittee members introducing themselves to each other today. So if you could just keep your cameras off, your mics muted, and just observe, that would be great. One more thing, if you wind up in a room and you feel like you might be in the wrong room, it's not the committee you were assigned to, or you're a member of the public and you were hoping to be in a different room, just feel free to jump back to the main room. And the way you do that is there's going to be a button in the lower right-hand corner of your screen that says leave. Click on that, and then you'll be offered 2 choices. One is leave the meeting. Don't do that because you'll be out completely. And the other is leave the breakout room. And that'll send you back to the main room, and Nicola and Anne will be in the main room to help you get to where you're trying to go. So that is the plan. Again, you should have, all of our CRIS committee members have these instructions and can repeat them when you get to your room. One last thing also, as I mentioned earlier, if you could try to keep your introductions to 2 minutes, that would really help us get through all of the subcommittee member introductions in each of the rooms. All right.